Hello everybody, I'm Jacqueline. The subject I'm dealing with today in this video is Medical Surgical Nursing 1, and the unit chosen is Altered Immune Response. In this, the topic is Ankylosing Spondylitis. The definition of ankylosing spondylitis, in short form they call it as AS, it is a chronic systemic inflammation. The word systemic means it includes most of the body parts, or many of the body parts has been inflamed or being affected. And the word chronic is it's a longer duration. So the chronic systemic inflammatory disease of the skeleton axial skeleton is the main or spinal cord, okay, with the variable involvement of peripheral joints as well and non-articulating structures. This mainly affects our spinal cord, and it also affects our peripheral joints, that are the hand and elbow, knees, ankles. All these joints are also being affected. So these inflammation of these particular joints are called as ankylosing spondylitis. This AS is one of the seronegative spondyloarthropathies. The word pathies means pain. Okay, why it is saying like this is it has a strong genetic predisposition due to a particular genetic factor called as HLS, that is due to that particular BL27 immune system infection will lead to this infection. When you already saw the unit name is altered immune response, because our immunity has been damaged due to that one, these kind of diseases will happen. We'll see what are the particular reasons. This before starting the reason for it, causes, the other name for this ankylosing spondylitis is, you can see in the screen, that is Bechterew disease or Marais-Strumpel disease, or the other name for this particular disease is Bechterew Mar, and then it's Strumpel disease. These are the different or alternative names for ankylosing spondylitis. The pathological changes you can see here, what it happens in this disease is the normal how our spinal cords are being arranged is there will be bone, and then there will be a ligament layer, and then again the bone, because it acts as a cushion or cushion factor. Okay, that is how a normal spine looks like. When it comes to ankylosing spondylitis, in early stages it starts to uh, fuse. The upper bone starts to fuse with the lower bone and to the upper bone as well, because it is being structured one after the other. But the layer in between is a jelly form, or the ligament, or you can also call it as a disc. That one acts as a cushion. When we bend forward or backward, this will act as a cushioning factor, which will not give friction to the upper bone to the lower bone. But in ankylosing spondylitis, these bones starts to fuse together. In early stages it starts to grow and inflame, and then in the later stage it will start to fuse together. When they fuses, there will be problem in the movement of the spinal cord. So the particular areas which this ankylosing spondylitis, that is fusion of the bone, takes place are sacroiliac joints, and then intervertebral joints, and then costovertebral joints. Costovertebral joints are the particular joints which connect to the central spinal cord, those bone joints, and then brachial joints, which are also called as shoulder joints, and then coxofemoral joints, we also call it as hip joints. And then the other joints are such as knee, ankle, small joints in the hands. These are the parts where this ankylosing spondylitis can happen. The risk factor, people are very much prone to get this diseases are sex factors, such as men are very much likely to develop ankylosing spondylitis rather than women. And then when it comes to age factor, generally it affects the old age people or early adulthood. It takes place especially late adolescence or early adolescence. And the heredity factor is the main reason what I said, the heredity factor, that is HLA B24. The full form of this is human leukocyte antigen B24. This particular antigen in the body will cause ankylosing spondylitis. But many people who having this particular gene in their body does not develop this disease, but people who already have this disease are very easy to get this kind of disease. The diagnostic evaluation to find out the ankylosing spondylitis is physical examination. We will be assessing what particular joint has been affected. Through X-ray we can find out which bone has been fused, and then MRI scanning, ultrasound, and individual medical history will be taken to find out what genetic disorder they are doing and has, and then genetic testing will be done to find out particularly antigen of HLA-P27. This is done through the genetic blood test. Another blood working will include the clinical features, the clinical manifestations, and the symptoms which causing this ankylosing spondylitis is aches and buttocks, lower lumbar aches, bony tenderness, peripheral joint involvement, that it feels a griddle joints. That means the stiffness in the joints will be seen, inflamed backache will be there. People are morning stiffness will be there, and then improvement with the exercise will be seen. And the posture, you can see the person, as you can see, it's a question mark posture will be seen. The person who's ankylosing spondylitis will lose the lumbar lordosis and will be fixed to kyphosis. Kyphosis means the person's spinal cord will be forward bent to the front side, which looks like question mark. And then the complications such as the inflammation of the eyes and then eye sacs, tear glands, compression, fractures, heart problems, and then other respiratory tract infections or all kind of symptoms will be. The treatment given is physiotherapy, steroids to reduce the inflammation, and then painkillers will be given, and then these are the how we find out ankylosing spondylitis. If you have a doubt, you can ask me. Thank you for watching this video.